Well, good afternoon, happy Saturday, and welcome to the Colorado Springs School of Massage Facebook Live session. Hi, my name is Joe Alberto. I'll be the director, I'll be your teacher today, and I would love to show you some stuff about hips and how it can affect sciatica and all of the different things that are involved there. But you know what? Step into my office. Let's get some training done. So, I wanted to kind of play around with a picture first. Most of us, we're guys, we're gals. First thing we look at, first thing we think about when somebody comes in with butt problems is a picture like that. But once we get trained, once we start going out there and doing our job, now we start thinking about that. There's a lot of muscles in the hip complex, in we call it the hip complex. It's the glutes, it's the buttocks. Each butt cheek has got 9 huge, powerful muscles that can affect the way we sit, the way we walk, the way we stand, the way we sleep. There's a lot of complexity in there. And, it's kind of funny. Many times we'll have a client, they'll come in and they'll tell you that, oh no, don't touch my butt. It's just fat down there. And it's like, we can't skip that. We've got to work on that. So let's learn a little bit more about that. Let me sit down and get comfortable, and I want to show you another image. And in this one, it shows a little bit more clearly. Superficially, we just see the glute maximus, which is a huge, powerful muscle. We use it for standing. We use it for climbing stairs. We use it for climbing the incline or going hiking up steep trails. Very powerful muscle. We've got the posterior leg muscles, the hamstrings, that are very strongly tied into the glute complex and can affect us very much. But look, beneath the glute maximus, we have got a bunch more muscles down underneath there. Now, we talk about the glutes and we talk about the lateral rotators. And the lateral rotators are the ones that are actually more complex. We sit on those more directly, and lots of big, powerful nerve bundles pass through there. I'm sure you've heard of sciatica. The sciatic nerve passes through that gluteal complex, and we'll start rattling off some names of muscles if you like, but right here between the piriformis and the superior gemellus, there's a little gap right there. Through that gap, from underneath this bundle of bone, that's the sacrum, through that gap and then on down the leg is where the sciatic bundle travels. Now, if you can imagine that the piriformis gets injured somehow, it gets really, really tight. It starts to compress anything that's around it. The sciatic nerve is what gets compressed, and we'll have these nervy radiations down our leg. Sometimes we'll lose sensation. Sometimes we'll lose strength. Sometimes it's pain. So we have to kind of watch those areas fairly closely when we're working on the glute complex. And here's some of my notes. Some of the things that we'll hear from our clients that we kind of tune into. My butt hurts. Well, yeah, it's going to. I have stiffness and discomfort in my hips where they start to lose some of their range of motion, some of the ease of motion as well. Sometimes they'll come in saying that they've got weakness and nerve pain down in their legs. These are all flags, yellow flags at first, that tell you, okay, I need to pay attention to their glute complex and see what's going on there, those lateral rotators. Some of the things that we want to observe. Extension. Let me show you. Extension of the leg at the hip is where the leg goes posteriorly. When we're going backwards with that leg, we are performing extension at the hip. Flexion at the hip is where we bring our knee up. This angle right here is showing that we are flexing the leg at the hip. Then there's also rotation. We can rotate the leg outward. We can rotate the leg inward. There's different muscles that are in use when we're doing rotation. We can also do where we abduct our leg outward. We're moving away from the midline. And then bringing it back in, we're using a whole other set of muscles to adduct when we bring the legs together. So those 4 different functions, extension, flexion, rotation, adduction, and abduction, there's 5 total, I'm sorry. When we're doing all of those, and there's an impediment somewhere, That's where we have to learn about what muscles are involved, not only the primary muscles, but secondary muscles and opposite muscles, antagonists. Very important to know how they all work together and what to do about them. So what do we do about them? Let me discuss some of that. We wind up using effleurage, which is that gradual warming stroke. Petrissage, which is where we start kneading the muscles. We like to do stretches for the gluteal complex in the legs. Those are amazing. They help to restore a little bit of length to those muscles. So when you start working out the knots, it's a lot easier for you. We like to do compressions where we really press down hard. We can do a variety of different compressions. We can do friction. We can do cross fiber, circular cross fiber. Those are all different methods which we love to show our students how to do, more so than just the plain Swedish strokes, but we start getting into more complex strokes. What about when we start doing some of those muscle energy techniques? Well, that means that we're starting to engage the muscle against resistance to cause the muscle to fatigue and return back to a normal resting position when we let off of that engagement. We can also do pin and stretch type methods where I'll sit there and I'll grab the muscle and then ask you to engage the muscle and move through that compression. They can be a little bit painful, but at the same time, they're very effective at releasing muscle spasms and knots in muscles that are not functioning correctly anyway. So let's get in there and work on those and get those released. So as you can see, there's lots of muscles. You saw that there in each buttock, in each butt cheek, there are 9 different muscles. And these are the most powerful muscles in the human body. So if you're a massage therapist and your clients are telling you, oh no, that's just fat down there, don't work on that, be firm. You know that you need to work those muscles. We learned those in school, and it's part of what makes you successful. Touch the body with knowledge, touch it with understanding and experience, and you'll have a good result every time. So is anybody out there needing to ask a question?
I like that word needing, Joe. That's good. As you know, I had an injury recently and involved my glutes, and I noticed a couple times I came in here, it really got addressed.
Yes.
And I had an injury I didn't expect to have, but there I was. And then I noticed you gave me some advice, get some exercise, and started exercising more, did some swimming, and I was impressed. It really improved. All of that together was necessary.
And it does work all together. As an instructor, I like to teach our students how to work the body, but it's almost as important to know what to tell your client how to help themselves recover from this instead of keep coming in for massage over and over and over again. If you don't do something at home to change what is causing the problem, then we're never going to get a resolution. And sometimes that means, you know what, start doing some stretching, maybe some yoga. If you know an exercise regimen, please go after it. Swimming is a great low impact exercise, which we're not trainers. We're not therapists in the way of physical therapists or chiropractors or MDs. We can't recommend, we can't suggest. That's out of our scope of practice. But common sense is the greatest ally that you can have. And if that means put your body through some range of motion, some calisthenics, that's easy stuff to do, and it's not going to hurt you. But it'll help, and that's what happened with you. You had a great result from that. Thank you for sharing.
Oh, and Joe, I have to tell you, your students, your graduating students that were still here, they were a key role. They played a key role in that.
I remember you came in and saw one of our students, and you walked out of the room with a whole different look about you. You were very relaxed, and you weren't limping anymore when you walked out of the room. That was pretty cool.
Oh, yeah. So, Joe, I'm guessing that there are people watching this that are wondering, wow, could I learn how to do that? Could I learn how to give that kind of massage?
Oh, absolutely. I mean, we all have a need to help somebody else feel better. And we get a lot of that. Whenever we have a potential student, somebody who's looking to enroll in our program, we'll sit down with you and we'll ask you a series of questions. It's very important, I think, to have that personal interview to make sure that, one, we are the right school for you, and two, that you're the kind of student who's going to be successful in this program. Because not everybody will be. This is a very high-intensity course. It's very fast-paced. And we are looking for motivated self-starters because, after all, you're not here as a hobby. You're here to start a new career, because that's what we're preparing you for, is a new career. And everybody has an opportunity to be the best student that they can be. And that's what I'm looking for. I want to make sure that you are going to be successful, and we will give you every tool in the book. We'll give you every opportunity to pick our brain and to learn from us. And yes, you can definitely be successful in a program like this. Did that answer your question?
That's perfect. I noticed people jumping on here, and they're taking part in this too. They're watching.
Excellent, excellent. Well, I encourage all of you, you know what, go to our website, www.csschoolofmassage.com. Look through our website. We've got a good detailed explanation of what we do, how we do it, some of our thoughts, what makes us different. And we are different. We're a very different school. And I think you'll find that we give you a very broad background in business, in how to be the best therapist you can be, how to be the best massage professional that you can be. I think you'll like what we have to show you. And call us, 719-310-9297. I would love to give you a tour of the school, answer your questions, and who knows, you might be my next interview. So with all of that said, and understanding that, the glute complex is very complex. So don't just think that you could climb on a machine and do some exercises and work through it. You might be able to, but call your massage therapist. Your massage professional will be able to help you get through it. And that way, it'll only take you 2 or 3 days instead of 2 or 3 weeks to get better. So with all that said, have a wonderful weekend, and I hope to see you on our next live session next Saturday. Thank you. Catch you later.